Hi, everyone. Welcome to Sonata Insights Live. I'm Tara Murphy, Senior Director of Global Marketing and Advocacy at Gynesonics. Sonata Insights Live is a program that we've launched to spark conversation about fibroids, the symptoms of fibroids, and the treatment options. During these episodes, you will hear from guest physicians, patients, and advocates as they share stories and educate our audience. I am very excited to have Dr. Young with me today. Good evening, Dr. Young. Thank you for joining us.
Hello, everyone. Hi, Tara.
Hi. I'm going to give a little overview of your bio. So, as a leader in modern women's health solutions and a highly regarded gynecologic surgeon, Carolynn Young is a trusted physician for women of all ages, treating patients at Rockville Gynecology in Rockville, Maryland. After completing her undergraduate degree from the University of Michigan, Dr. Young earned her Doctor of Medicine from Vanderbilt University School of Medicine in Nashville, Tennessee, where she was inducted into the Alpha Omega Alpha Honor Society. Throughout her career, Dr. Young has gained extensive experience in pelvic floor surgery and minimally invasive procedures. Dr. Young regularly speaks at conferences and teaches her peers about modern surgical procedures and women's health topics. She has special interest in uterine fibroids, abnormal bleeding, contraception, adolescent gynecology, and abnormal pap smears. When she's not busy caring for patients, Dr. Young enjoys spending quality time with her family and friends and likes to travel to experience new cultures, exercise, read, and enjoy boat rides. She also truly enjoys learning about and experiencing anything to do with Italy. So thank you for joining us.
And it's my pleasure. Thanks again for having me.
For sure. And you're also a contender to hold a world record. If you want to share a little bit about what you're a contender for, I think that's a really fun fact.
Yes. So I will likely be inducted into the Guinness Book of World Records at some point this fall, holding the highest number of fibroids removed during one surgery from one patient. And that surgery I performed in December of last year, and we removed 258 fibroids from one patient. And the previous record, I think, is 217. No, 236. So we beat it by a little bit. So we're pretty excited about that.
That's fun. It's like we have a celebrity here today. So I want to just talk to you a little bit about, fibroids and educate our audience on information that they need to know so that they can leave watching this conversation with a little bit more information than when they started. And as they go to speak to physicians, they feel more empowered about the information that they have. So if you want to just talk a little bit about, what are fibroids?
So fibroids are very, very common. Between 70 and 80% of women have them. They are benign tumors of the muscle wall of the uterus. So the cells proliferate and form a benign tumor. Now I say benign, 99.5% are benign. There is a very rare type of fibroid cancer, and we don't have a good way of figuring out, detecting who has that rare type of cancer. Many women who have fibroids have no symptoms at all, so they actually don't even know they have them. Sometimes they can be detected at an annual pelvic exam if the clinician feels the uterus is enlarged and orders an ultrasound, and that would likely diagnose fibroids. Are symptomatic and so seek care because of symptoms such as heavy or abnormal bleeding, pelvic pain, bloating, pelvic pressure, pain with intercourse. Those are the main symptoms.
And when a woman has these symptoms, she should contact her doctor, obviously. But when a woman would come to see you, how would you determine that they actually do have fibroids? How do you diagnose?
So it would be a combination of doing a pelvic exam to feel what's happening, especially the size of the uterus, and then getting an ultrasound, which we have here in the office, but there are a lot of radiology facilities, and it's really by ultrasound that we diagnose these benign tumors.
And you talked a little bit about one of the symptoms being abnormal bleeding. Can we talk a little bit about what actually should your cycle look like? Because I think a lot of times, as you know, your mom has fibroids or abnormal bleeding, and your sister and aunt and everyone else. So you start to think that certain things are normal that aren't quite normal. So can you talk a little bit about what a normal cycle should look like?
Absolutely. So a normal cycle should last 8 days or less. Most patients, thankfully, have cycles that are less than 8 days. It is not normal to have bleeding in between periods. It is not normal to have periods super close together. And the parameter we use is 21 days. So if it's 21 days, less than 21 days from the first day of one period to the first day of the next, that is considered abnormal. In terms of heavy bleeding, this is a little bit subjective. When I ask patients about their bleeding, I ask how many days does your period last? Of those, how many are heavy? And on a heavy day, how often are you changing a pad or tampon? Every hour, 2 hours, 3 hours? And we typically consider heavy bleeding if you're changing a pad every 1, 2, or potentially 3 hours. The other two parts of it that warrant attention is whether or not the bleeding is causing anemia. So it's important to get a blood count check to make sure you're not anemic. And sometimes it's important to check an iron and a ferritin level. You can sometimes have a normal hemoglobin, but actually be iron deficient. So if a patient doesn't complain of heavy bleeding, but is anemic, and we think it's due to moderately heavy periods, then we need to do something to improve things. Conversely, some women complain of heavy periods and their hemoglobin, their blood count's totally normal, but they can still have heavy bleeding that is disrupting their lives and interfering with their quality of life. So there's some subjective portion of abnormal bleeding and some objective.
And if you have fibroids, can you have a cycle that seems to be normal or lighter, and then your next cycle is really heavy, and then the next one is it, or does it usually have a pretty
It can sometimes do that, but how fibroids affect bleeding is basically related to where the fibroid is in the uterus. So if the fibroid is in the lining of the uterus where an embryo would be, or if it's touching the lining of the uterus, those are the ones that tend to cause heavy bleeding. Sometimes episodes of flooding and passing clots, sometimes large clots. So those are called submucosal fibroids. Some fibroids are near the outside wall of the uterus and actually do not cause heavy bleeding at all. But depending on the size, they may cause pelvic pressure or pain or abdominal distension. I see many, many patients that look like they're 5 or 6 months pregnant, and they're not pregnant. They just have enlarged uterus due to fibroids.
Wow. And so we know, based on your contender to be a world record holder, there are a ton of fibroids, but could you also have one fibroid that causes you a lot of issues, or can you have multiple, 2, 3, 4 fibroids?
Absolutely. You can have any or all of that. It's really those fibroids that are touching the lining of the uterus that can cause the heavy bleeding. I had one patient who I took care of last year who was 26 and had one fibroid, but it looked like she was 9 months pregnant, 9.5 months pregnant.
Wow.
And I did a surgery on her and took out her fibroid. It was 10 pounds. So she had no heavy bleeding, but my goodness, she had significant abdominal distension, pressure.
Wow.
Yeah, 10 pounds, bigger than most babies.
Yes, it is.
Yeah.
That's big. So what can cause fibroids? Do we know yet what the cause of fibroids are. Knowing that this many women suffer from fibroids, do we have an idea of what is the cause of them?
So we don't know specifically, but there's definitely a genetic component. So if your mom or your sister have fibroids, you have a higher incidence of having them. We know that African American women have a higher incidence of having fibroids. Um, there's not anything that studies have shown that we could do to prevent fibroids, but anything we can do to live a healthy lifestyle in terms of exercising and eating a diet rich in fruits and vegetables, low in saturated animal fats. If you have fibroids, may help them not grow as much. Now, fibroids do tend to grow until menopause, and the average age of menopause is 51, 52, and then fibroids will shrink a little bit. So if a woman is bothered by bleeding caused by fibroids, when she goes in menopause, no more bleeding. So that problem is solved. Extension, fibroids are large. If you have, let's just say, a 6 centimeter fibroid in menopause, they shrink to 5 centimeters, 5.5. So it's not like it's going to shrink to tiny or go away, but some of those bulk symptoms sometimes improve a little bit at menopause.
And so you could get to menopause and they may shrink. If you don't get that far into having your fibroids and getting to that point, I wanted you to just start to talk a little bit about what are the treatment options available, kind of going from the least invasive with medical management, and then we could kind of move on from there.
Sure. So the least invasive, I tell patients this all the time. If you have heavy bleeding and you buy Aleve over the counter and you take 2 pills twice a day, right when you get your period for 2 or 3 days, that actually decreases bleeding in 30 to 50%, even in women who don't have fibroids. So that's just a little pearl. If that doesn't work, there is a prescription medicine called Lystita, which is tranexamic acid, which works on the blood clotting system to decrease bleeding. And this is a non-hormonal medicine that you take only when you're on your period. So right when you start your period, it's 2 pills 3 times a day for up to 5 days. And it works very well at decreasing bleeding. It sometimes can give women a headache as a side effect, but most tolerate it very well. There are definitely lots of different hormones we could give to help bleeding caused by fibroids, either birth control pills, progesterone only birth control pills, or higher dose progesterone medicine that's not actually a birth control pill. And in a lot of women, that works really well, especially if you need contraception. Some women can't tolerate hormones or don't prefer to take them. Depending on where the fibroids are located and the size, some women are a candidate for a progesterone releasing IUD, which is a small T-shaped device made of plastic that goes in the uterus. Here in the office, it takes less than a minute to place. The progesterone keeps the lining of the uterus thin, so periods tend to be much, much lighter. And it works for contraception for 8 years, the ones that I'm referring to. Depending again on whether or not the fibroid is touching the lining of the uterus and how big it is, if a woman has completed childbearing, she may be a candidate for endometrial ablation. And that's done either here in the office or in a surgery center or a hospital where under IV sedation, so the patient's asleep, we first look inside the uterine cavity with a small camera that's called hysteroscopy. We do a gentle D&C, which is a gentle scraping, just to get a few cells to send to pathology, and then we cauterize or gently remove the lining of the uterus. And in a lot of women, that helps bleeding significantly. I've even, depending on their symptoms, done ablation and put in a progesterone releasing IUD, and that seems to be a wonderful combination for a lot of women. Moving on to the more surgical options, there is a wonderful option called Sonata that's been around for a few years. I've had great luck with. So this is done through the vagina under IV sedation. I put an ultrasound probe in the lining of the uterus and do ultrasound so I can see all the fibroids. And then one at a time, I stick a little probe into each of the fibroids and deploy these needles, and it uses energy to kill the fibroid fibers. So it doesn't get rid of the fibroids, but it'll take a fibroid that's like a golf ball and make it into a marshmallow. So it'll soften it, and it is very effective at decreasing bleeding, and it does decrease the bulk size of fibroids somewhat. The procedure, depending on the size and number of fibroids, takes anywhere from 1 to 2 hours. You go home 1 or 2 hours later, usually with just ibuprofen, mild to moderate cramping for 1 day, back to work the next day. So I really feel like Sonata is a game changer in terms of improving heavy bleeding, doing something that is minimally invasive, very low risk procedure in terms of complications, back to work the next day, and you don't have to take a medicine for years. So I've had wonderful luck with Sonata. Other patients consider uterine fibroid embolization. That's done by a radiologist, where they put particles into the arteries that feed the uterus to block the blood flow. That causes fibroids to shrink. That usually is an outpatient procedure, 7 to 10 day recovery, oftentimes with fever and bad pain. And then it takes about 6 months, 3 to 6 months to kick in to make periods lighter. It will shrink fibroids, but going back to that 6 centimeter fibroid, just as an example, after uterine fibroid embolization would probably go down to 5 centimeters. So it's not going to shrink them tiny. Depending on whether or not a patient desires future childbearing, it could be a candidate for myomectomy, where we actually cut the fibroids out of the uterus, and that can either be done laparoscopically through small incisions in the abdomen, or depending on the number and size of fibroids, abdominal, which is usually a bikini cut incision, which does confer a longer recovery. And then if a patient is done having children and they want definitive treatment, a laparoscopic hysterectomy is a wonderful option. Again, through small incisions in the abdomen, take the uterus out, but leave the ovaries so the patient does not go through instant menopause. So they would feel just how they feel hormonally, but not have any bleeding. In general, that surgery takes about 2 hours. Most women go home the same day, and they feel pretty good in about 2 weeks. So I love it. There's so many options, and I actually left off a newer one that is FDA approved to treat bleeding from fibroids called Myfembry. It actually lowers your estrogen level. It's 1 pill a day. It has been FDA approved for 2 years. It does a very nice job lowering the bleeding, but it can sometimes cause hot flashes because it is lowering your estrogen level. And then there is a concern once you take it for 2 years, because it's lowering your estrogen level, that it could possibly increase your risk for osteoporosis if you're on it long term. So that is a wonderful option in someone who's 49 or 50, and we think we just need to get them to menopause and then the bleeding will stop. So I did want to mention that. There is another drug called Orian, which is essentially the same thing as Myfembry, but it's twice a day.
You give a great overview. Good. One thing that I think you and I have probably heard a lot when we do our patient education events that I want to make sure that you can educate our audience on a bit is when you go on a medical management such as a birth control, a lot of times we hear from women that because their symptoms stopped, they thought that their fibroid had stopped growing. Um,
Mhm.
so I just wanted to make sure that you could talk a little bit about that and how the different medications could affect or could not affect that. From
Yeah. So we do think that fibroids grow um, when they are exposed to estrogen, maybe progesterone, but definitely estrogen. So in a combined estrogen progesterone birth control pill, we oftentimes see fibroids growing. Um, so the symptoms, the heavy bleeding may improve, but fibroids would definitely need to be monitored by an ultrasound once a year. If they get really large, 8 centimeters, 10 centimeters, even if a patient is not bothered by pelvic pressure or distension, sometimes the ureters, which drain the urine from the kidneys to the bladder, can actually get compressed from the fibroids. And it causes a backup of urine in the kidneys that's called hydronephrosis, and it can damage kidneys. So even if they're not having problems with bleeding, just the bulk size of fibroids can still cause negative health effects.
Thank you. And, as you gave such a wonderful view of all of the treatment options that women have available, I wanted to talk a little bit about and get your advice to women about if they went in and saw a physician that didn't talk to them about all of their treatment options or just kind of went in and said, nope, this is your only option. This is the only thing that we're going to do. And don't really hear them of, what they want for their patient journey. What advice would you give to a woman about how to navigate that situation or what to do for next steps?
I really feel strongly that they need to get a second opinion. I mean, the internet is such a powerful tool to figure out who specializes in treatment of fibroids. Minimally invasive GYN surgeons. You can search in your local area and see who's doing that. In terms of Sonata, it's growing and more providers are doing it, but very few in my area, which is the Maryland, DC, Northern Virginia, do it. So it's worth a Google search. It's worth talking to other family and friends about their experience with their gynecologist. But I think it's important to be cognizant of just the fact that there are so many options. And if your provider is really just saying it's birth control pills or hysterectomy, that it's worth getting a second opinion.
Thank you. And talking a little bit more about Sonata. So you've explained that it's an incisionless procedure and kind of a little bit about what the recovery looks like. What have you heard from your patients that you've treated with Sonata as far as, how their outcomes have been and what the procedure was like for them the day of?
Um, the vast majority have had a great post-operative experience. I've had one patient with a little bit of more pain than I expected, but everybody else just takes ibuprofen for a day or two, back to work, minimal pain. Some women notice an improvement in their bleeding right away. And can also feel that the uterus is shrunk a little and softer, which helps with the distension symptoms. Other women, it takes maybe up to 3 months to see significant improvement in bleeding, so it's a little bit variable. If a patient has fibroids that are touching the lining of the uterus, submucosal, some patients will have a watery discharge for a month or two after surgery as everything heals. So I always warn them just so they're aware that that's normal and to be expected. About 11% of women who are treated with Sonata do not have great outcomes, and we end up retreating. I wish we never had to, but what I love about retreatment is, again, it's no big deal. It's an hour or two in the operating room, back to work the next day, minimal pain. So it's not like you're signing up for another big complicated surgery with a long recovery.
Thank you. And when a woman has fibroids, say you do Sonata or any other procedure that isn't a permanent hysterectomy, let's say, can a woman get fibroids again? Like once you have some fibroids, you may remove the fibroids that were there, but can you continue to produce new fibroids?
Absolutely, absolutely. Even in the myomectomies where we are laparoscopic or abdominal, where we're taking out every single fibroid, I always counsel patients that there's at least a 30% chance new fibroids may form in the future that may or may not need treatment.
Yes, I've heard, once you're someone that makes fibroids, you continue to make fibroids.
Yeah, yeah.
Yeah.
And like the woman where I removed 258 fibroids, she's going to make a lot more fibroids, because a lot of the ones I took out were really tiny, called seedling fibroids. So some women will just have that one, like my 10-pound fibroid patient with one fibroid, and then the other one, 258, and a lot of them were really tiny.
Yeah, every woman is different. Every fibroid is different. Every treatment.
Yeah, and I think after treatment, it's just important to monitor your cycle and how you're feeling in terms of bleeding and pain.
Great, thank you. If anyone has any questions, you could put them in the comments, and we'll be sure to have Dr. Young to answer those. She also did mention about where she's located in the DC, Virginia, Baltimore area. So if you would like to be connected with her or any other physician in the country, we have a physician finder on our website at sonatatreatment.com. So you can go on there and put in your zip code and find physicians in your area to be scheduled for a consultation. We also have a nurse advocate that can help direct you and guide you to Dr. Young or any other physician in the country that may be near you. Anything else, Dr. Young, that you want to share with our audience to close us out for the evening?
I don't know. I think as there has been an increased awareness of fibroids, I think it's important to continue to talk about it in social circles, to support one another. If you see a friend or someone suffering because of pain or heavy bleeding, just encourage them to seek help, because there are just so many great treatment options. And that's what gives me so much pleasure in taking care of women with fibroids, because we can try medicines, and if that doesn't work, we can try surgery. If that doesn't work, we can take the fibroids out. So one way or the other, we're going to make their quality of life so much better. And that just brings me so much joy when I see them back months and years later, and they just can't stop smiling because their quality of life has been restored. So keep talking about it.
I think that's a great point, because as we know, as women, we're constantly just silently suffering and saying, oh, I'll take care of myself later. I have so many other things to do for my kids or my husband or my family or my parents or whatever it may be. And so we're always putting ourselves to the side. So when women are able to find a physician like you that's going to talk to them about all of their different treatment options that are available, and talking to them about options like a medical management or Sonata that could get them back to normal activity the next day, it's really nice to be able to start to have those conversations and understand there's a lot of other women, actually the majority, that are out there suffering from fibroids. And if you find a doctor like you that's going to talk to you about all of your treatment options, it's going to help you to be able to actually treat yourself and make sure that you're taking care of yourself so that you could take care of others as well.
No need to suffer.
Yeah, that's exactly right. That's the lesson for us for today. No need to suffer. There's so many.
No need to suffer. Yeah.
Yes. Well, thank you very much for your time. And as I said, to find a physician or be connected with Dr. Young, go to sonatatreatment.com, and we will be able to navigate you to her. Our next Sonata Insights Live will be on November 26th at 3 p.m. Pacific, 6 p.m. Eastern. And if you have any questions or would like to be connected with Dr. Young, please do so through our website, and we'll be sure that our nurse advocate connects you with her and her office to answer any questions you may have. Thank you, Dr. Young. You're always the best.
Thank you. Have a great evening.
You too.
Bye-bye.
Bye.